Hey there. Before we get started on today's episode, I wanted you to know that on February 21st, we are offering our first physician brand and AI bootcamp. You guys, this is a 3-hour working event. It's not a webinar, it's a workshop. You're going to be building stuff. You're going to be using our custom GPTs, making your own GPTs, and walking away with content generating agents that are going to build for you forever. It's going to be awesome. Please go to superdoctech.com/AI bootcamp and use the coupon code STORIES to get 50% off your ticket. It's going to be February 21st, Saturday morning, 9 a.m. to 12 p.m. Pacific. See you there.
All right, welcome back to Super Doc Stories. I'm so excited today to be hosting one of our very own Super Docs, Dr. Griselda. I'm your host, Dr. Mona Sodi, and we're just going to be having an open conversation about her beginnings as an entrepreneur, what's been difficult for her, what's worked well, and kind of where she's at right now. So I'm going to let Dr. Griselda come on here and introduce herself to you all. So thank you so much for being on the podcast, Dr. Griselda.
Thank you. Thank you. Yes, so as Mona said, my name is Grizelda Anguiano. I'm a pediatrician and been focusing on mental health since 2019. So
Awesome.
joined, I guess as Mona was saying too, like joined SuperDoc, I guess at the July kind of Independence Day sale type.
And we've loved having you. It's been quite the journey, and we feel so blessed that we've gotten to see your growth from where you started in July up until now. But I know there's some history even before that. I mean, you've been a solo practice business owner for several years now, but I want to rewind that a little bit and tell me a little bit about kind of who you are and what's gotten you to this point today practicing that anchored health and anchored coaching.
Yeah. So I guess if from the anchored perspective, when I left private practice in 2012, I had started, no, it wasn't 2012. So in 2019, when I had started just doing medication management, and the more I started learning and reading and doing, more courses, I started to realize that there was so much more that we can do than just the medication. And so I really started kind of bringing in the family together, and I started to see the changes, right? That I was working at a psychology office where some families would, the kids would see the therapist, and then I would meet with them and meet with the parents. The therapist would come and stop by the office. So I was really able to kind of start learning it from different perspectives.
And just so our listeners know, you're a pediatrician by training, and
Yes.
now you focus solely on ADHD treatment and coaching for the parents and the family. So, just for context, I wanted to give our listeners a chance to understand that and how you've really evolved and niched down into this specialty. So, please
Yes.
continue.
And that's kind of where the fun has been, right? To really seeing even sometimes generational changes, right? To breaking those cycles and to see how, bringing the whole family
I
together
love
and
that.
understanding from different perspectives. So I have ADHD and, raising a family of some with ADHD. So it's not only personal, but it's definitely, transformative for my own family.
If you're enjoying SuperDoc stories and thinking about building a practice on your own terms, you're probably wondering how to get all the tech pieces to actually work together. SuperDoc Tech is the operating system for cash pay practices. Mona and I built it for our own clinics, and now we're sharing it with physicians everywhere. It captures every lead, books more visits automatically, and runs your patient acquisition 24/7 with AI and automations. New practices can skip years of guesswork. Established clinics finally get a back end that works. Head on over to superdoctech.com and use coupon code PODCAST50 to get 50% off your first 3 months. That's over a $1,000 value. Now back to the episode.
That's amazing.
That's where, and the anchor just comes just from, being able to, wherever we're at, right? We could choose to pick it up and put it somewhere that serves us better.
Absolutely. I love that. And who better to provide this type of coaching and service than someone who's experienced it themselves. And that really, we'll get into that later, but when it comes to building your brand, you really lean into, this is why I'm the person to help you with the problem that you have because I've walked in your shoes and I know what it's like. So for those of you listening that might be scared to kind of dive deep and branch off onto your own. I know in the field of obesity medicine, there's so many people starting that are scared of the big box competitors. And I tell them those big box competitors can never be you. They can never replicate your authentic self. And there's no amount of money, there's no amount of advertising that they can do to do what the individual can do to build their brand. And I think you're a role model when it comes to that, really.
And thanks to one of our recent goal setting webinars, one of the words that came out was abundance, right? And there's enough for all of us. And I think the way you were saying we're each unique in what we bring to it and how we serve the population we choose to serve.
Absolutely. Being abundant in your thinking as opposed to coming from a scarcity mindset is so important. It's so important to live in that zone of, the growth, right? And having that mindset that yes, I can grow. There are enough resources for all of us to go around, and I'm not scared of entering the arena to compete and just show up as my authentic self. Can I ask Dr. Griselda, what originally pulled you like towards entrepreneurship? What made you leave the employed position you were in?
I think the more I was seeing that I kind of wasn't fitting the mold, right? And I wanted to do things I guess now I can see the freedom that it has provided, but that at that point it was just like I did what I wanted to do and what I saw was working wasn't going to fit what was out there at that moment. So, I really didn't know anyone doing kind of a DPC type practice. I really hadn't heard of these type of things, but I'm like, can I continue to prescribe medication? Sure. And that was kind of at the end when I just started doing, the coach training. But even
Okay.
going back in life, I've started businesses with my parents. I had a chocolate, kind of a candy store, a
I
little
didn't know that.
another restaurant. So it's not until I kind of go back and it's like, the seeds have been getting planted
Uh-huh.
throughout the years. And my parents would kind of like, okay, let's try it. Is that what you want to do?
Yeah,
Let's try.
I love that.
Yeah. And it's just the grit to keep going and go through. And it's not going to be easy, but it is going back to the why. Like, why are we doing it?
Yes. I was just listening to an Alex Harmozy podcast, and he was saying that the easy way is not the way. The hard way is the only way because nothing is easy to like big things are not easy to accomplish. So I think just knowing that and knowing that you've been through different trials and different businesses really makes a difference because if you think you're going to go and be an entrepreneur and it's going to be easy, well, there's a rude awakening for you on the other side of that. So going into it knowing, hey, I'm going to have some dips and I'm going to be in the gain sometimes. And we talk about that a lot, inside SuperDoc Tech and how we've just got to live the gaps and the gains, right? We've got to live in the gain more than we do in the gap and realize when we're in the gap. Tell me about, so when you did make that leap to transition to your own DPC style practice, how did you get your first clients or early traction?
But for me, it was a blessing that a lot of the patients I was seeing at the other clinic followed me.
Okay.
They were asking, how do we find you? And of
Right.
course you can't
Right.
say anything, but
Right.
luckily someone had planted the seed to just get, a domain and just set up a mailing list. And so I did have a lot of people follow me, which was nice because I thought, well,
Right.
there was a lot of people with insurance, a lot of people that were choosing to use their insurance before. And I think it was the relationships that I had built with them
Hmm.
that allowed, they already knew me. They trusted me. They liked
Hmm.
me. They saw kind of the growth and all that I was doing. So it was easy. Yeah.
Yeah, that's amazing. And it's a testament to the fact that the work is always working for you, even if you're in an employed position, it's not the ideal fit. Well, the effort you put in and the relationships you built are everything, right? Relationships are really everything. And I think it would give a lot of the doctors listening that are currently employed some hope to just keep going and that it will work itself out as long as you show up as your authentic self, people will follow you. Now, you were practicing, remind me, as a traditional or full spectrum pediatrician before? Okay.
I
And
was
so,
initially out of training was a hospitalist, and then I went into private practice and I did that for 7 years, and then I went to do the kind of working at a therapy office.
okay. So you were working for a therapist or for a
It
bigger
was it was
organization. Okay. As a medication prescribing physician for ADHD patients. Okay. And then you decided to branch out into your own DPC style practice. Got it. Okay. So that's important to know is that you were going kind of from like to like. It's not like you were going from general pediatrician and going all the way to ADHD management alone. So that was probably pretty
and that
helpful
was a big jump there.
to
I
go
love
from
doing
pediatrician. Oh, for sure, to let go of the bigger subspecialty. But if you knew that was your passion and that's how you, the way you wanted to help people, something you said earlier was, I recognize that there was, I think you said a gap, there was a need for
that.
this type of treatment. And so I sought to fill that need, and that's huge because a lot of us, when we're going into entrepreneurship, we think that we know the problem that people need before we've actually done an inquiry or really surveyed people to find out what their needs are. You were pretty right on when you said, "Hey, I'm observing that they're asking for this treatment and they're needing this treatment. Let me build something off of that." And it was working, right? So that's really important because you may build the most beautiful practice. You might, some people take out big loans to build out this amazing boutique practice that they think everyone's going to want, but they've never really tested the market or validated it. So that's really important to know what is the actual need. I was talking to another physician and I thought this was really insightful that she said that she's a surgeon and she would kind of live in different forums like Reddit and that kind of thing
Mhm,
for patients
mhm.
that were seeking help with the type of surgical problem that she solves. And she would just listen. And very, very rarely she would offer something to someone and say, "Hey, I'm in your state. I can offer this kind of solution for you or connect you with someone." And they would say, "Oh my goodness, yes, yes, yes." So she would kind of scan these different forums to find out what are the patient needs. And so now she's building a direct care practice based off of that. And, she's softly validated it. It's not like she's got, invested a bunch of money into figuring out, what the market gaps are. But it is important to know, kind of like have your ear to the ground, like what are people really needing right now? So I love that you're kind of attuned to doing that.
Yeah,
And
and it's still pivoting,
right.
when you're learning and if you keep hearing someone asking for something, it's like,
Yes.
well, should I get into that? Should I not get into that? And
Right.
get in alignment with what my future vision is for the practice too.
That's amazing. That is so amazing. And when the work you're doing is aligned with your future vision, that's a win-win, right? For you and for your patients. So what would you say was something unexpected or messy that happened early on in starting your practice? And what did you learn from it? If you had any advice for our listeners who are thinking about starting a practice, what are some tips and tricks that you would share in terms of early, rough spots maybe that you encountered?
Yeah, I mean, I was blessed to have come across someone that who had kind of started a similar type practice, but so they said you need, talk to an attorney, get your CPA, talk to, but to go to be paying your own malpractice insurance. And then, I do have a brick and mortar, so it's to have insurance at the office and all of the other
The
pieces.
business liability. Hmm.
Yeah, that we don't, I hadn't really been thinking about when I
Mhm.
wasn't paying those bills,
Right,
so that was a change. And also just everything coming from my pocket as far as, the EMR and as far
right.
as, and still I'm the only one answering the calls and doing all of those pieces. I mean, with Super Doc Tech, it's a lot easier, but it's to be, I am the one that is doing
Yeah,
all. Yeah.
that's true. It is you, right? And it has to be you. And sometimes even when you hire someone, they're not staying with you forever. And so it is you at the end of the day that's picking up the phone. So how did you manage that early on? If you were the one answering the phones and seeing patients and doing the refills, like how did that work? How were you your own receptionist and the clinician?
Well, and I think just doing it, right? I
Just
knew
doing it.
was doing it. I mean, I
Yeah.
knew the whole reason and I was determined for it to succeed. And I
Determination.
know that I am ready to get
Yep.
help and to hire and the oiling up the machine and making sure everything that way I know what to expect from someone and I know exactly what it is that I need.
Right.
Um, but yeah, it hasn't been
Yeah.
easy, right? And sometimes, my husband or the kids will say, like you're always working and I'm working on that too, right? But it's the boundaries and everything. But initially getting started is kind of like I'll take whoever, whenever,
Yes.
however I can take.
Yes. Yes, I want to talk about both of those things. So the first thing is the boundary setting and having boundaries, because I think for a lot of people, especially that are hospitalists, that maybe it's a little bit easier to kind of clock in and clock out and turn off your pager or whatever is that you have on in the hospital. Moving from that type of practice to your everything. I mean, the lights are on because of you. It's all consuming. And so it is important, I think, even early on to set a boundary to say, okay, EMR after this time, only emergencies, right? So how have you kind of worked to improve your boundaries over how many years has it been that you've been open now?
So in 22, December of 22 is when I
Yeah,
opened, so
yeah,
it's a full 3 years
full
already.
3 years.
And it's different now than it was then, and I'm still working on it, right? The boundaries. But I will say studies have shown, and some of the early mentors had also said, once they know, patients know that they can get a hold of you if they need you, they respect it. I even had one send me a text last night at 10 o'clock, and they said, I'm sorry, I know, but just whenever, right? Or and I don't feel the pressure that I have to do it then. I mean, if it was an emergency, they know what to do too.
Right,
However, it's I think the boundaries, it helps them too. It
right.
helps them to say like, okay, is it an emergency right now? Or and sometimes it's taking advantage of the system, right, for some
Yes.
people, but it's when you start to really set it up from the beginning, it makes the clarity is so much better,
Mhm.
not only for us,
Yes.
but for the
Yes.
patients.
Setting expectations is so very important. And that's important to know that you are attracting your ideal patients because they do respect your boundaries and you're okay to set them. So it's two-sided. It's attracting the right person and then setting the next expectation there, but saying, hey, I am here if this is a true emergency. And that does give them peace of mind. Whereas if they don't know what the boundary is, they'll push it probably.
Yes.
And that'll go that way.
And I
Um,
think now for people that are just starting, right, that initially, some of it was coming from desperation and I'll take whoever, right?
Yes,
I'll do
yes, I
that.
wanted to talk about that. Yeah. So tell me about that. So you, in the beginning, I think most of us would agree that you're just happy to have anyone be your patient. And you're like almost surprised that they would come see you for something, whereas you've been a practicing physician for over a couple decades, right? So it shouldn't be surprising, but there's something about being an entrepreneur for the first time that you're kind of giddy and you're like, sure, I'll take anyone, like anyone. And your prices may be rock bottom. I've experienced that even in real estate, having short-term rentals where the first few clients you get, you're just elated and you're shocked that anyone would rent your property. But really, this is, how the world works. We open a business and as long as we have the right messaging, we get the right clients to match. So tell me now, kind of in the beginning, maybe you took all comers that might not have been an ideal fit for your practice. Tell me now, kind of, what is your position on taking patients and how has that changed?
Well, I've really been embracing the meet and greet part of it and just even saying, even if I do the initial evaluation, doesn't mean that we're going to have a subscription, right? Because the way I
Right.
usually do it is we'll do an evaluation and then some of them just do that part. Some of them go into the coaching practice and some medical practice and some both. And
Yeah.
so, and there's been times that it's, I really feel that one, it may be that they need to be, being served by a psychiatrist, right? That yes, I've had a lot of extra training and I'm really comfortable in what I do, but I also know my limitations. And that with time has gotten better too, that I can say, okay, this is something that needs to go somewhere else.
Yes.
And also it's, when people ask me, now I can clearly say my ideal, client is
Mm.
someone that's willing to do the work, right? Because the
So they come to
medication,
the table ready to put in the work. That's huge.
yeah, because if it's a click, click, send, that's easy, but that's not why I'm in practice.
Right, right. So many parallels to the obesity medicine world, right? In my private practice, I could also just be sending prescriptions, but that's not the way that I want to practice. And so meeting people and telling them, hey, you've got to be willing to put in some work is so critically important. Otherwise, you will attract the wrong client and you'll burn out as a result because you're not doing the type of work that fulfills you and is aligned with your mission. So that's hugely important. And if you're listening to this, I want you to remember that it's easy to feel desperate and to want to cover your overhead initially, but really keep in mind your ideal avatar. It is so critically important to your longevity as a clinician. And sometimes when we're starting a business, we feel like we need success like yesterday, but it comes with time, right? It comes, you don't have a full schedule day one most of the time. It comes with time and let alone a full schedule of your ideal clients. You
Absolutely.
you know you may, but usually it takes time to curate that. And being okay with the process is really important, and knowing that it may just take time for your people to find you, and that's okay. And just refine your message, double down on it. I think that knowing that you know who your ideal client is. It's someone that wants to put in the work, not just receive ADHD medication. I feel like that would allow you to show up to your discovery calls more poised, more confident, and actually probably increased your conversion rate because you are the authority and you are saying, no, I don't just take anyone. If you just want medication, this is not the right place for you, but I have resources for you. I know we've talked about that before, right? Like you've met someone that wasn't a great fit for one reason or the another, and you've said, here's a list of places that you could go. Maybe they're looking for an insurance-based solution. And there's no sense of trying to talk them into your solution if it's not for them, but you just be that person and say, hey, I've got a great person for you. And I really do believe that it all comes back, right? If you put it out into the world, it will come back to benefit you. You'll never know how, but
And some of them, I feel like they've, even if they called and actually you just need a I would start with a therapist with what I'm hearing. And I tell
right,
them, we could still do this part or however, but even if some of them have come around,
right.
sometimes they've just sent somebody, right? They've
Ah,
sent
yep.
the
Hmm.
referral part has been huge, but yeah, I mean, I feel that it's knowing what I'm worth is also,
Right.
key. And just one other thing I was going to say, when initially I really wouldn't talk about kind of the coaching passion or like the whole family part. I would just be like, oh, they're not going to want to pay for that, or they're not going to,
Mhm.
that's going to be too much.
Assuming.
Yeah. And so I would just come from the medical part, but then I would be frustrated. It's like, but I know I can do so much more. And
Right.
that's not what they had agreed upon.
Right. So for our listeners, Dr. Griselda has two businesses really. So one is for ADHD coaching for the whole family, and that supports her ADHD focused pediatric mental health practice where she prescribes medication. And so I think you've got a lot of overlap between the two because they are complementary to one another. And so it's wonderful that you've been able to tell patients, hey, we can do the medication over here, but I still want to support the whole family over here. And I think it's the right thing to do. And they trust you, right? Because you are.
And I have some that it's just in the coaching, or I'm coaching, an adult with ADHD and I'm not managing their medication. And now I get to refer to my, friend and colleague, Dr. Gilbreth, who can see them as adults. So
Yes,
yeah.
yes, I love that. And you know what your parameters are and you know who you can help, which is amazing. So I want to shift a little bit to you as the founder, um, an entrepreneur. So in this process of becoming an entrepreneur, a business owner of two businesses, how has that changed how you see yourself? I know you mentioned you know your self-worth, but
Mhm.
has it changed anything else within you? Have you evolved as a person, do you think, as a partner, as a mother?
I mean, I think the part of what you're building, right? And even if it's like, what are we building as a family, or what are we building as a business, or what are we building, or why are we building this funnel? And I think it's always kind of coming back to that purpose. And I feel that, I'm the tool, and this is what I'm being used, to deliver and serve others. And I feel that having this vehicle and especially with Super Dark Tech, like building it out has made it, I just feel like more freedom to do kind of the fun parts of things. And it's been less work, to,
Oh, It
Mhm.
feels like less work. So many gems there. It feels like you are the tool and you have this vehicle to help patients and your family build the life that you want. That's so important. It really is a journey. And it sounds like
And
you're
it's
you're
just
enjoying the
what's
ride.
the legacy, right? What am I
Yeah,
going to leave behind? Why am I here? And
right.
not to get too,
Yeah.
philosophical or spiritual, but still it comes from that. Yeah.
It all matters. It's all integrated. And if you can tie it together and see your why, that is wildly important. And you will be successful if you keep connecting it back to your why. So, what is working really well right now in your business? Is there anything? I know you've mentioned SuperDoc Tech, but other, tech or non-tech, what's working for you right now in your current state?
I think what's working for me is the relationships, right, that I'm building, the networking, and just the clarity. Like the more clear I am with who I'm here to serve and what am I doing and why I'm doing it, that's what's working. And yes, I mean, getting with the tech part, it was always one of those like, no, no, I don't need that yet. I don't need that yet. But I wish I would have, I don't know that I would have been ready for it earlier, but I think that now it's freeing up, definitely has been a lot of work, but it's been worth it. And it's freeing up a lot of the other things so that I can be more creative and I can serve more and I can do more
Yeah.
and
What's been
have more
your
time for myself.
more time for yourself, right? Setting
Yeah.
that boundary. What's been your favorite part in SuperDoc Tech so far?
Yesterday I was kind of had a working meeting with one of our, fellow super doc techs, Dr. Gilbreth, and we both kind of just like, wow, like we're kind of badass. Like we've gotten a lot done today. And
Yeah.
I left with my husband for a doctor's appointment, and she stayed here, and then I came back and we did all the forms and we did contracts and just the accountability. And it's like the amazing part of being able to understand how it's done, how it,
Mhm.
and if something needs to be tweaked or why it's not working. I mean, that's been awesome. Like that was
Yeah.
just we both
Yeah.
just like, hey, and we didn't want to stop, but I'm like, I gotta go.
Yeah. When you're working and it doesn't feel like work and it feels like your creative juices are flowing and it's your business. And it's so important to understand how it works because before you hire someone else, right, to take on that type of work, you are the common factor because like we said before, the employees may come and go, but you need to know how things work and how to change them. Otherwise, you're helpless,
And
right?
it
You don't
feels
want,
great to understand it. Yes.
yeah,
Mhm.
yeah. And you've built so much. We're really proud of you and we're really honored to have you with us. And it's been our pleasure to watch your growth. You've been really successful both personally and professionally. So thank you so much for sharing your story with us. And I think you've probably inspired quite a few of our listeners to think about making that leap from employed medicine to entrepreneurship. So thank you for your contribution there as well. Where can our listeners find you or work with you if they need your help? You're in Texas, correct?
Yes, I'm in Texas, so for the medical practice, definitely if anyone needs support from that area. And as far as coaching or support, especially in the, neurodiversity area and ADHD, I can global support there.
Not just in Texas, right?
Yeah.
Okay.
So through either of my websites that I've built through, SuperDocTech, so anchoredtx.com or AnchoredTX Coaching, they can cross, to the other area. But yeah, so I'm on
Awesome.
Facebook and LinkedIn and Instagram. I haven't gotten to all the live videos yet, but it'll come.
Yeah, they'll come. And you're taking new patients on both ends for the
Yes.
medical practice
Mhm.
and the coaching. Awesome. So we
I'm
will include
choosing
that,
them wisely, but yes.
choosing them wisely, right? So we will include all of that information in the show notes. Thank you again so much for your time. We really appreciate all of your insight. And thank you for being a super doc. It's been our pleasure.
Yes, and if anybody needs to reach out as far as like where do we start with, just kind of the practice part, not that that's part of anything, but somebody did that for me and pay it forward.
Awesome. That is really sweet. All right, Dr. Griselda, thank you, thank you, thank you. And I'll see you at our next meeting.
That's good.